Good morning. My name is Dr. Jordan Weiner. I am a practicing physician in Scottsdale. I'm an actual doctor.
All right.
I would like to discuss something today that I think is being missed in the media as this debate about health care goes on.
It's all being missed!
The hidden tragedy is what state-run health care does to physicians. President Obama talks about the services that I provide as if they're a commodity.
He's a liar!
As a commodity, the government can simply debate the best way it is to distribute the products of my effort in the most cost-effective manner possible. I am not a commodity. Unlike a robot, I had to consciously dedicate more than a dozen years of my life to acquire the skills and knowledge of my profession. When I practice medicine, I have to continuously use my best reasoning and rigorous thought to treat the patient that I'm taking care of. At night, I read medical journals to better understand how to take care of tomorrow's patient. It is my effort, my ability, and my reasoning that results in the excellent patient care that I am able to provide. In a free market, or whatever is left of one in healthcare today, I offer my skills to serve the needs of my patients. The harder I work, and the better that I take care of my patients, the more my reputation grows and my practice succeeds. This then provides me both emotional and financial rewards that accompany a successful medical practice. President Obama now proposes to take over healthcare completely, either in one fell swoop or incrementally, continuing the path of nationalization started in the 60s. When the government pays for my services, I am looted the value within me, which I have spent my life building. The government will determine the quantity of my reimbursement, short-circuiting the free market system of greater reward for greater ability. Under the present Medicare system, upon which any new government healthcare system will be based, there is one reward for physician for a given service. The lousiest physician actually gets paid the same as the greatest. Whether the physician trained at the most prestigious medical institution in the country or couldn't get into a U.S. medical school, so he went to the Caribbean, there's one low price for his services. Whether the physician has a wonderful bedside manner or utterly lacks empathy, the government pays the same. Whether the surgeon's skills are brilliant or barely acceptable, there's one low price. Can anyone here imagine how this system would work if applied to other sectors of the economy? One low price for a car, a cell phone, or better yet, an athlete or a musician? This provides no incentive or reward for quality or performance. But don't worry though, the trial lawyers tell us that it is they who bring out quality by scaring physicians into practicing good medicine. What they don't understand is that threats may through fear change our behavior, and that is a big reason for the cost of healthcare today. But they don't bring out hard work, dedication, and compassion. Only freedom can do this. The second and more evil part of government-controlled and financed healthcare is the intellectual takeover of the physician. The government will decide which treatments warrant coverage and which don't. And please ignore any claims that the doctor and the patient will still be able to do whatever they want. Once they do the paying, everyone falls in line with what they decide is the best or cheapest treatment. The constant exercise of my mind and my judgment will be abdicated to physician government committees, which will replace my judgment with theirs. The patient won't even know what they're missing because it won't even be offered. This is slavery of the mind. Does President Obama think that my mind and the minds of other physicians will continue to achieve, innovate, and continue the noble tradition of medicine in this great country when he shackles us intellectually and financially? What physician wouldn't mind these controls? Only a fool would dream up a scheme that harms the very people he counts on to take care of his health. I am speaking here today to help warn our country. If President Obama thinks he can take over, control, and distribute the products of minds like mine, he is in for a rude awakening. A good mind does not tolerate controls. What he will be left with, unfortunately, will be the kinds of minds that do. That should scare anyone who hopes to receive the sort of medical care they have known in our past. We need to stop this new stage of fascism. Our lives depend on it.